other material that is used as a preventive measure is pit and fissure sealants. Now, what are these pit and fissure sealants? Sealants are a safe and a painless way of protecting your tooth from decay. It is a protective plastic coating which is applied on the biting surfaces of your kid's back tooth. This sealant provides a hard protective barrier from food or bacteria into entering the grooves of your kid's teeth. Now, which teeth are normally used for pit and fissure sealants? These sealants are only usually used on the back teeth, that is, the molars and the premolars of your kids. These teeth have small pits, that is, small hollow structures, or fissures, that is, groove-like structures on their biting surfaces. Your dentist will advise you on which tooth in your kid's mouth should be sealed once it is examined. Any tooth having deep fissures is the most ideal tooth for pit and fissure sealants. Some teeth have naturally deep fissures, whereas some teeth have shallow fissures. It is in these shallow fissures that pit and fissure sealant is not required. The application process is usually very quick and straightforward. The tooth to be sealed is thoroughly cleaned, treated with a special solution, and then dried. Once the tooth is completely dried, a liquid sealant is applied into the deep fissures and deep pits. It is allowed to set hard, usually by shining a bright light onto it. You might have concerns whether your kid will feel any kind of discomfort. These procedures are totally pain-free and does not feel any different later on. Usually last for many years. But it is advisable that you take your kid for regular checkups just to see whether the sealant is in good condition. Sealants have a tendency to wear over time. So your kid's dentist will make sure to fill any gap with the sealant or replace the sealant so that there is no new decay which arises underneath. We often get this question: how do these sealants exactly work? Now, the deep grooves and pits in your kid's tooth forms a ground for breeding of bacteria. It also facilitates lodgement of food particles. This leads to dental decay over time. Now, these pit and fissure sealants cover up or form a protective barrier in the grooves and pits, thus making the biting surface self-cleansing. Since there is no grooves or pits present, the lodgement of food particles becomes less, as well as bacteria gets flushed out easily. When should you get your kids for a pit and fissure sealant procedure? Sealants are applied as soon as the first permanent molar erupts. This is usually between the ages 6 to 7 years. The rest can be sealed as soon as they appear into the oral cavity, normally between the ages 11 to 14.